So it's a very good question, actually. So in general, when we talk about quackery, because quackery is a very common in the field of medicine and then in the field of nutrition as well. So when we talk about the potential health risks, so as I mentioned earlier, so sometimes we see irreversible consequences among patients. So because quackery can result in misdiagnosis, it can lead to poor prognosis of the disease. When we talk about nutritional quackery specifically, it can lead to muscle loss, it can lead to poor skin, it can lead to hair fall. We observe so many nutritional deficiencies among people who have been following a fad diet. A fad diet is the one which is not really backed by scientific evidence and which promises quick fixes as promoted by the quacks in the field of nutrition. Similarly, impaired bone health is very commonly observed. Electrolyte imbalances are very, very common. Even you could have issues such as infertility. So all these issues are related to your health, which are actually which can actually be due to nutritional quackery. Similarly, when we talk about the economic risks, so as you know, in Pakistan, out-of-pocket spending for health is very, very common. And given the inflation during the last 2-3 years, given the unemployment, nutritional quackery can really take a toll on your personal finances, on your budget, because what we don't recognize is that once a person becomes ill in a particular household, then the economic structure of that household is largely impacted. So the quackery can actually prolong the risk of hospitalization. It can prolong the length of hospitalization. It can increase the risk of hospitalization. It can result in the poor prognosis of diseases. So yes, there are lots of economic risks associated with quackery as well. Right. So first of all, when we talk about a licensed or a certified nutritionist, so there are two terms actually which we use. One is a nutritionist and the other is a dietitian. So when we talk about the term dietitian, dietitian is actually a legally protected title. So in most of the developed countries or high income countries, as we say, the profession of nutrition and dietetics is very much regulated. So there they have a council which registers the individuals who have got proper academic degrees in the field of nutrition. Then they appear in the state or the national level examination, then they qualify it, then they have their training from an accredited hospital, and then they have to maintain their nutrition related knowledge through continuous nutrition education, just like the medical doctors, just like we have PMDC here in Pakistan Medical and Dental Council. And on the other hand, we have a second term, which is the nutritionist. So nutritionist is generally not a legally protected title. It's a self-proclaimed title. Anyone can claim to be a nutritionist, provided that he or she says that I have so and so much knowledge of the field of nutrition. So for a common man, what the common man can do is, first of all, always look out for the academic credentials of the healthcare provider to which you are going for your nutritional advice. So what degrees the individual has, from where the individual has got those degrees, what is the type of training that the individual has. Then talk about the experience, whether the individual has got experience of working in a hospital or not. That is what the common man should look out for. Also, it can be really, really simple if you want to differentiate between a nutritional quack and a professional dietitian or a licensed dietitian. So you will always see quacks working in the field of nutrition overemphasizing on the significance of certain foods. They will always be talking about eliminating certain food groups entirely from your diet. They will always be making claims which sound too good to be true. They will always be making promises that you will get so and so much of results overnight. So they will be talking about superfoods. They will be talking about detoxifiers. They'll be talking about purchasing expensive supplements. So all these should be the red flags whenever an individual goes to seek nutritional advice. First of all, when we talk about the local health authorities, what I believe is that a nutrition and dietetics council is the need of the time here in Pakistan. Pakistan, unfortunately, is one of those few countries in the world where we are suffering from a triple burden of malnutrition. So when we use the term triple burden of malnutrition, that means that on one side we have undernutrition, on the other side we have overnutrition, and the third aspect of triple burden of malnutrition is micronutrient deficiency, is also known as hidden hunger. So which country other than Pakistan would be more in need of a nutrition and dietetics council? A good news is that very recently in Pakistan, we have now established an allied health professionals council. Back in the year 2022, this council was approved by the Senate, and only a few months ago, it has started working. And its operations are now going on. And there are approximately 30 fields which fall under the Allied Health Professionals Council. However, what I genuinely believe is that nutrition and dietetics, since it is such a big, huge field, there has to be a separate, dedicated, exclusive council to look after the affairs of this field only. And only then we will be able to work within the domain of nutritional quackery as well. So first of all, the need for a council in Pakistan is absolutely important. Secondly, regarding provincial and federal governments, I think lack of regulations and implementation of those regulations. So the role of healthcare regulatory authorities, that is very important. So there should be absolutely strict actions on the quacks, whether they are related to the field of medicine or related to the field of nutrition or any other field, be it psychology or any other field. There should be absolutely strict implementation of policies. No one should be allowed to practice quackery, and if found, definitely strict legal actions should be taken against all those persons. So that can definitely have a good impact. Then on the part of healthcare providers, it is also the responsibility of the hospitals to hire only qualified dietitians and nutritionists, because what I have seen personally is that a lot of good famous hospitals, they also sometimes hire individuals who do not have a relevant degree, who do not have relevant training within the domain of nutrition and dietetics, and that itself promotes nutritional quackery. So on the part of hospitals, that is also a very important step that they can take, and that should be there in the policy of the hospitals. Because if you talk about medical doctors, no hospital would be hiring any medical doctors who doesn't have a license from PMDC. So same should be the case with the field of nutrition and dietetics. Broadly speaking, there are so many stakeholders when we talk about nutritional quackery, basically, and academia is one of them. In addition to being a practicing clinical dietitian, I also belong to the field of academia, and I've been associated with teaching and research for over a decade now. So I know the intricate details associated with this when we talk about academia. So I think educational institutions definitely have a very important role to play when it comes to curbing nutritional quackery. First of all, I think we definitely need to educate our students from very early on regarding the meanness of nutritional quackery and the kind of consequences and impact it can have on the health of the patients, on the health of the individuals, on the health of the community overall. Secondly, I think where we generally lack here in Pakistan is the teaching of ethics to the students. So obviously, when you talk about quackery, that by no means falls under the domain of ethical practice. So that should be a part and parcel of the undergraduate curriculum at every level. So whether you are teaching medicine or psychology or nutrition, there should be a separate subject, a separate module based on the ethics or ethical practice. And when you look at the high income countries or the developed countries, as we say, they all of the curricula there, especially at the undergraduate level, they have this module called ethics or ethical practices in medicine or ethical practices in nutrition. So only then that is going to emphasize the significance of this phenomena, basically. Secondly, when we talk about religious leaders, obviously, I think in a country such as Pakistan, still religious leaders can play a very, very important role in sort of decreasing the problem of nutritional quackery. We have seen this in case of polio, for example, in certain parts of KPK specifically, where parents were quite reluctant to have their children vaccinated for polio. So we sought the services of religious leaders, and we saw tremendous results in those areas, because still in Pakistan, people look up to religious leaders for a lot of issues. So if this is made a part of their usual conversations, if they could appear on the media and they could highlight the problem of nutritional quackery, then that can definitely be fundamental in curbing this issue. And then when we talk about media, I think media has got to play its role. Unfortunately, what I believe is that in Pakistan, whether we talk about electronic media, whether we talk about print media, whether we talk about social media, it is very rare that we see productive discussions. It is very rare that we see health-related issues being highlighted. It is very rare that we see different sorts of research studies being discussed on the media. So I think media can play a very, very important role in this. How many times we have seen nutritional quackery being discussed in the talk shows, which you see after 8 p.m. on all the news channels. How many times we see podcasts such as the one we are having right now being played on the social media. So it also goes to show the interest of the general public. So the content that is there on the media is also dictated by the preferences of the viewers as well. So we can't really blame the media alone. We as a nation, as a community, would also need to change our priorities and our preferences as well. So that's a two-way road, basically.